Hi, I'm Brittany Montez, and this is the Orlando Health News Review for April 26th. Orlando Health Hospital's freestanding emergency departments, physician offices, and ambulatory sites took part in a regional full-scale mass casualty drill. During the drill, teams enacted emergency policies and worked with volunteers to simulate and prepare for a real emergency.
Today, we had approximately 50 hospitals with almost 2,000 volunteers that participated. We had the Federal Bureau of Investigations, or FBI. We had the Department of Homeland Security, or DHS, here with us. We had the Florida Department of Law Enforcement, or FDLE. We had local law enforcement. We had local hazmat teams, local EMS. So we had tons of partners here with us. We always get a ton of learnings from this, both positive, things that worked well, and also things that we can do better. Areas of improvement is what we call it. We do all of this in preparation for the real thing. And we hope that it never happens. But today, the importance of this, the reality of this is if it does happen today, tomorrow, next week, next month, we are far more better prepared to respond to that disaster because we practice it.
And last week was National Volunteer Week. Sites around the organization took the time to acknowledge, recognize, and celebrate all of our volunteers for generously giving their time and talents to help the Orlando Health team and for always showing kindness, patience, and understanding to everyone they meet. And Orlando Health's Your Best Place to Work Committee is excited to announce that the second annual Orlando Health Way Scholarship Program is now accepting applications for children and dependents of Orlando Health and Bayfront Health team members.
So this is our second year of the Orlando Health Way Scholarship. We've had a really good history of providing benefits to our existing team members. One thing that we wanted to look at is how do we help the family members of team members? And so we came up with the scholarship idea last year. We awarded 11 scholarships to family members, and we start the second round April 24th of this year. We're really just excited to really change lives, but also it's just another example that shows why Orlando Health truly is your best place to work.
I can be proud of what I do and pass it on to my children so they can join the field as well. The fact that she's going to choose a career in healthcare really makes me happy. It's something that she's been wanting for a long time, and finally she's into the program. She's getting the education she needs, and hopefully she'll be part of us for many years to come.
And Orlando Health and Bayfront Health are participating in the Orlando Sentinel and Tampa Bay Times Top Workplaces Survey for team members May 1st through the 14th. This confidential engagement survey just takes 5 minutes to complete and will help provide insights about your workplace experience. On Monday, May 1st, 6,000 team members at Orlando Health and Bayfront Health who were randomly selected to participate will receive email invites from our approved vendor.
Well, team, it's survey season, so we just wrapped up our Modern Healthcare Best Place to Work survey, and we want to hear from you again. We are participating in the Orlando Sentinel Top Workplaces for Central Florida and the Tampa Bay Times Top Workplaces for Tampa Bay. This is actually the first time that our Bayfront Health team members will be participating in our survey, and we are so proud to be selected as an Orlando Sentinel Top Workplace last year. Now, we have partnered with Intergage. Why Intergage? It's our third-party vendor to make sure that we keep your feedback confidential. It's not a phishing attempt, and we want to hear your voice, so take a minute and complete the survey today.
If you receive an email from survey@intergage.com, please click the link to begin the survey and help our organization continue to be your best place to work. See Swift for more details. And are you registered for Orlando Health MyChart? Are you sharing about its benefits with patients? Orlando Health MyChart gives patients immediate, secure digital access to their personal medical information to conveniently manage their appointments, access test results, request prescription refills, and pay bills from anywhere at any time via phone, tablet, or computer. Jennifer Quilty, Chief Clinical Officer for the Orlando Health Medical Group, and Brad Kennedy, Senior Director for Customer Experience Programs, are here to tell us about this year's MyChart activation goal.
Well, I'm excited to share that this year in fiscal year 2023, we've set a MyChart activation goal of 57%. This means that among all the patients we see face-to-face, we want at least 57% of them to have an active MyChart. The best part is, as of today, we're already at 55%. We appreciate everyone's hard work to socialize MyChart to our patients at every opportunity.
According to a recent study, our patients who activate and use Orlando Health MyChart have 3 times more physician practice visits than those without MyChart. Also, patients with an Orlando Health MyChart score higher across 8 key HCAHPS measures, including likelihood to recommend us. These amazing results confirm that MyChart not only provides more visits to Orlando Health, but delivers a better patient experience too.
Visit Swift to hear more about MyChart from Jennifer and Brad. Well, that's it for today's edition of the Orlando Health News Review. We'll see you next week.